Welcome everybody to this session on this training breakout session on using CI Par with the MedAccess EMR. In the session today, we're gonna go through the orientation presentation that we have available to everyone on our website. Go through it, see what's in it and why it's there, talk a little bit about how to use it, and hopefully answer any questions that come up as we go through it. Before I get started in the presentation proper though, I'm just gonna come off of the presentation view and have a quick look at the slide sorter view of the presentation because it's fairly big. There's a lot of slides here and a fair amount of information in it. And if you're using this, it's probably unlikely that you're going to have time to present the whole thing all at once to your audience. You most likely will have to be judicious and pick and choose the things that are appropriate for the meeting that you're having. And it's designed and intended to be used that way, which is why we'll go through it all and discuss what pieces should be used in what situations. And before I go back into my presentation view, I'm just going to minimize that for a moment and show you a couple of the tools that I'm going to be talking about through the presentation. So I have here the Accelerating Care Transformation Team website up. It's act.albertadoctors.org. And if you go here and hover over Patient's Medical Home, you'll see that there's a CI Par section. And here we have primary care tools and resources and practice facilitator tools and resources. The content there is the same, but the practice facilitator section is organized slightly differently, hopefully more intuitively for practice facilitators to find what you're looking for. And so some of the things that I am going to be showing you today are the mapping guides, which will be really important. And so you can see here, there's the TELUS MedAccess mapping guides. There's a one-pager, a two-pager. These are designed to be printed up on 11 by 17 paper, really big, nice and easy to see, and also the community encounter digest that goes along with them. And we'll look at those in a minute. The orientation presentation, which I'm about to take you through, is also here. If you click here, it'll upload the PowerPoint presentation to you with all of the information that I'm about to show. And finally, the MedAccess EMR user guide. Apologies, I'm more used to the other page. Here we are in the EMR user guide section, the TELUS MedAccess CI Par user guide, which I'll also be referring to through the presentation today. So we'll just bring the PowerPoint back up and get started. All right, so here's the orientation PowerPoint. And the first slide in it here is one that's designed just for your information. It's meant to be hidden. You probably would never use it to show anybody, but I mentioned that there are different sections in the presentation. This kind of divides it up in terms of which slides in the presentation belong in which section. So the first section we're going to look at is where did CI Par come from, and then why CI Par, etc. For future use, it's easy. It'll be easy if you can go to the presentation and just quickly look and find the set of slides that you're wanting to use for whatever interaction you're going to be having. The first slide in the presentation is one that we most often use at the beginning of our presentations, especially in the current environment. It's easy to forget where did CI Par come from and why are we doing it. And it's important to remind people that CI Par were at the request of physicians. The Central Patient Attachment Registry was requested by the section of general practice at the time, which is now the section of family medicine. They were looking for a way to identify primary providers' attachments to their patients. And a commitment was made to build this tool by Alberta Health. And then also specialists were looking for ways, easy ways to get their consult reports to Netcare. And that was kind of the impetus for the creation of the Community Information Integration, or CII. It's helpful to be able to remind our audiences that, in fact, this is asked for and created for docs to deliver better care to their patients. Oops. The next section is on the why of things. Why are we doing CI, CPAR? What's the reason? It's really cool technology, but of course we're not doing it just because it's cool technology. We're doing it for a good reason, and the reason comes down to better continuity. So this particular slide focuses on relational continuity, and the Central Patient Attachment Registry is quite important for relational continuity. But also there are aspects of informational continuities. The community information integration helps to better share information across the spectrum of healthcare so that information is available for docs providing care to patients. And also there's an aspect of management continuity in this as well. That better relational continuity and that better sharing of information leads to better handoffs, better care coordination and management of patients across healthcare deliveries. You've likely seen this slide before. Really, this is a summary of a literature review on studies done on the benefits of relational continuity in primary care. There's all kinds of great information here about the evidence for positive outcomes as a result of increased relational continuity, and that's what CI Par is all about. Something that's maybe a little less obvious to audiences is how this is in alignment with PCN initiatives, but it is very much so. Continuity is something that is part of the patient's medical home. In fact, it's an implementation element. Hopefully you can see there's a section in the green area, panel and continuity, and that's square in the target of CI Par improving continuity. That better management continuity that I talked about is directly related to transitions of care. And that's definitely in alignment with PCN objectives. And the opioid response, which is sometimes a little less obvious how CI Par might be able to assist with that. But one of the things that CI Par enables are e-notifications back to physicians when their patients are seen for at AHS facilities for at emergency room, inpatient admissions and discharges, or day surgeries. And day surgery is particularly important for opioid response. If a patient is seen for day surgery and is at risk for opioid abuse and their primary care provider doesn't know about it, it's possible that they could be prescribed something that would be inappropriate and high risk. So getting those alerts is really important for physicians trying to manage patients at risk of opioid abuse. The evidence around relational continuity is so important, in fact, that the Toward Optimized Practice released a clinical practice guideline some months ago, focused strictly on relational continuity. And this is a bit of a first, as it's not strictly a clinical intervention, and clinical practice guidelines generally focus on clinical interventions. But in this case, the evidence was so overwhelming that it made sense to create a relational continuity clinical practice guideline. It's available on the top website, and it's actually generated quite a lot of interest. The World Health Organization, actually shortly after it was posted, contacted the AMA to discuss what was in it. So all of these slides are about the why, and if you're addressing an audience where you think they might need to know why it is that we're actually doing this, if they're not sold and they're not sure, hopefully these slides can help. The next section in the presentation is all about what are CI and CPAR. So for an audience that are maybe coming to this for the first time, or they've heard a little bit about it, but they really don't know what it's all about, these next few slides are really important and hopefully very helpful. The first one addresses community information and what is community information integration in a very basic way. And essentially CII, or community information integration, is just a data hub that can help move information from community physician offices into Netcare and also into something called the Healthcare Data Repository. So basically CII is a technology that allows information to move from one place to another. this is generally, if people are learning about CI Par for the first time, this is generally the first time they hear about the healthcare data repository. So we have a slide in here that describes the healthcare data repository, what it is, why it's there, and has information in case you get questions. So if you do get questions, the data repository, this slide is there to indicate that the data repository is there for analytics and system improvement. It's not there as a performance management tool. It has governance, so its use is governed by a group called the Health Information Data Governance Committee, or HIDGC, bit of a mouthful. That group has members from Alberta Health Services, the AMA, from the medical schools. There's public/patient involvement. There's representatives from CARNA there. The key there is that there is governance, and this isn't just there for anybody to use as they wish. It's actually very tightly locked down. The next slide is what is about the Central Patient Attachment Registry and what it's all about. So the Central Patient Attachment Registry is a provincial system that captures confirmed relationships of primary providers to their panel patients. Hopefully that's not new news. Some key information here, it happens automatically. It's really the next logical step for practices that have already invested in panel management. If you've done that great work to identify your panel, why not share that with everybody else so that everyone else knows too who your panel is. And of course, it's foundational for future enhancements. I talked a little bit about e-notifications. There's no way to do e-notifications unless there's some kind of source of information that can inform us where a patient's information should flow to, and that's the Central Patient Attachment Registry. There's a few slides like this one in the deck, pointing people to our tools and resources webpage that I showed you off the beginning. It's important to, we find it important anyway, to remind people on a regular basis that this information is available on our website and available for everyone to use. And ideally, people will eventually realize that it's a good idea to maybe favorite this so that they can always go there as a source of information. So that's sort of the basics. What is CI Par? The next section focuses on how does CI Par work? And this section is the longest section. It's very nuts and boltsy. It's all about the details of how CI Par shares information and helps to enhance continuity. And you've probably heard already in your training that CI Par focuses really on three kinds of information: encounter data, consult reports, and panels. So I'm going to go through each of those. We'll start with encounter data because this one sort of is maybe the one of most interest to physicians, particularly primary care providers. They want to know what information is coming out of their EMR. What does it look like? Where does it go? And this is very much, these next 20 or so slides are very much about that. So starting with encounter information, information flows from the community physician office through the CI Data Hub to Alberta NetCare and is displayed there in the form of a Community Encounter Digest or CED report. You'll notice that in this slide, the Healthcare Data Repository is also there. Information flows from here to the Healthcare Data Repository as well. If you've abbreviated the presentation and this is the first slide that has the Healthcare Data Repository in it, you may want to bring in that slide that I showed you before in case there are questions about the data repository. But we'll focus now on the Community Encounter Digest report and what it looks like and where the information comes from in the EMR. So hopefully you've seen this before. The Community Encounter Digest shows up in NetCare in a new item in the menu on the left-hand side called Community Reports. If that's there, that it means that there's a CED for the patient, and providers can click on it to have a look. If you hover over it, you get this little pop-up to see some metadata about the report. And then of course, if you click on it, it brings up the CED. And I can tell you that even though there hasn't been a lot of advertisement that these now exist for users who are using NetCare, they're finding them and people are using the CEDs to provide care. So you guys have probably seen this already, but I'll go through it again because it's helpful to be quite familiar with what's here. So the Community Encounter Digest looks like this. It's a PDF in Netcare. There are sections. The first section just lists encounters. So basic information there is when did it happen, where did it happen, who did it happen with, what's their role. So is it did they see a surgeon? Did they see a general practitioner? Who was the appointment with? The patient reason for encounter. So what did the patient say they were coming to be seen for? And then the clinician's encounter clinical assessment or a diagnosis. And we'll see where each of those comes from in a minute. Next is the health concern history. So if a new item is entered in the problem list, it ends up here, and I'll show you where that comes from in MedAccess as well. Possible allergies. So the system doesn't identify confirmed allergies versus suspected allergies. It just knows if an allergy was entered during the encounter, it's gonna populate it here. And of course that comes from the allergy section of MedAccess. I'll show you in a minute. Measured observations. So a few basic vitals show up in the Community Encounter Digest: height, weight, blood pressure, and waist circumference. Also the date and the source. If a referral is made during the encounter, that also shows up here in the Community Encounter Digest. I'll show you where that comes from in MedAccess in a moment. And though our picture here doesn't have an example, immunization information also is fed to the Community Encounter Digest, and I'll show you where that comes from too. This slide is one that we use sometimes, don't use sometimes, depending on how we think the interest of the audience might go. But essentially this slide is to show, all of the data items that were recommended to be shared by the Canadian Institute for Health Information, CIHI. So CIHI has sort of come out with a standard, and it was agreed that that standard would be followed when the project was set up. So this is the list of data elements. The ones in green are shared to Netcare. The ones in white are shared, the ones in green are shared to Netcare and the Healthcare Data Repository. The ones in white are just shared to the Healthcare Data Repository. And if you see the ones in white, they're mostly metadata, dates and times and things like that. And then on the right, there's the information that drives and feeds to CPAR. We're going to look at the mapping in the EMR in just a section, but before we do that, I want to talk just a bit about what conditions have to be in place in order for encounter information to actually flow to the CED. So certain things have to be in order for that to happen. Most of them are pretty straightforward, but it's important to let users know that these conditions do exist. So it has to be a new visit or modifying a previous visit that was included in Netcare. The visit or chart can't be marked as private. We'll talk about privacy in a little bit, but I think that's probably pretty obvious. If it's marked as private, it's not going to go. The patient's name, date of birth, and PHN need to be in demographics, of course, otherwise you couldn't identify the patient. The provider in the primary provider field has to be a registered participant, and of course that makes sense. They need to be registered in order for their information to go. The visit provider also has to be a registered participant in CI and CIC Par, and that actually brings up one of the devilish little details that comes up with CI and CIC Par. So if the provider in the primary provider field is not a registered participant and they're seen by a provider who is a registered participant, the information actually won't go because the owner of the chart hasn't said that they're willing to share that information. That's a little quirk that's good to know. We've got some information about that coming up in our publications as well. And finally, the visit has to be signed off. So in MedAccess, visits are signed off. Until they are, information is not shared to Netcare. And so for physicians who may take a little while to sign off their visits, it's good for them to know that the information is not shared until they do actually sign off the visit. So let's look at now some screenshots from MedAccess that show where information actually comes from in the EMR. Most providers find this really helpful, and I've seen a lot of providers just really, a lot of stress come off of them when they look at this. And their reaction is generally, oh, okay, that makes sense. So it's really helpful to be able to show them the mapping for their particular EMR so they can see, and it's much easier visually to see what information goes. So obviously demographics is important. I should point out that each of these slides has a little legend up in the corner. So some information is shared to Netcare, CPAR, and the healthcare data repository, so those fields are green. Some information is shared to Netcare and the healthcare data repository, but not CPAR. Those fields are orange. Some information goes to CPAR and the healthcare data repository, but not to Netcare, and those fields are red. And then there's some information that just goes to the healthcare data repository, those fields are blue. I'll probably concentrate most on the first three, the green, orange, and the yellow information. But if you have questions, please feel free to ask. So demographic information, obviously you need demographic information to identify the patient. And you can see it's basic demographic information that goes. The patient status is important for CPAR, and I'll say a little bit more about that as we go along. And highlighted down here is the confidentiality button. This is where you would click if you want to make an entire chart confidential, in case anybody is wondering. Oops. Provider information comes from the provider card in the provider section of the EMR, and of course, first, last name, and the specialty maps to the CED, which we'll see in a minute. Also identifiers for the physician load to the healthcare data repository to help identify physicians. The name of the site, of course, comes from site settings. You can see the site name there. And we'll spend a little time talking about information that comes from the visit, because there's a couple of fields here that are really important. And those fields are the concern field and the diagnosis fields. And the reasons that they're important is because they can be free texted. Most of the fields that I'm going to show you, or that I have shown you, are discrete data fields. So what's in them is just a number or a word or whatever, but it's not really editable. The concern field and the diagnosis fields are editable. So the concern field, as probably most of you know, actually starts out in the appointment as the reason field and comes through into the concern field in the visit. A lot of clinics use that functionality as a way to communicate. So the receptionist might enter something there, and that information will flow into the visit so that nurses and docs can see it, and the nurse may put information there for the doc, etc. That's all fine and good, but whatever's in that field is going to go to Netcare. So it's important that users know that, and we've already seen some clinics where they've had to modify their workflows a little bit because they were putting things there that they didn't really want to go to Netcare. So there's a couple of workflows that might be appropriate to adopt there. Either use something else for that communication, a notes field or something, or continue to use that field the way it is being used, but make somebody responsible for cleaning it up at the end of the visit to make sure that that information does not flow to Netcare. And that's probably not a bad practice anyway, excuse me. If you don't want that information to go to Netcare, then does it really belong in the legal record of care either? I think an argument could be made that probably not. Important to keep that field clean. The other one is the diagnosis field. So this one's not quite as serious, but you can, after you can free text type in the text area. So a lot of docs will type in the diagnosis number if they know it, or choose it from the list. And then once it's populated, they'll backspace over the text that's automatically put in there and type in something that they like better. That's fine, as long as they remember again that information will show up in the Community Encounter Digest report in Netcare. So good to know those two things. Other information that comes from the visit, of course, the date that the encounter happened, who was the provider, and then the vitals that we talked about are informed by observations generally on the right-hand side of the visit, so blood pressure, height, weight, waist circumference. You can see here that you can make the visit confidential by clicking down here. And of course, whether or not the visit is signed off is going to determine whether this information goes. And insurer doesn't show up in the healthcare data repository, but is sent to, doesn't show up in Netcare, but is sent to the healthcare data repository. I mentioned allergies earlier. So if an allergy is recorded during the visit, the only information that's reported to the Community Encounter Digest is the allergen. Other things that are recorded in that don't flow. It's just what shows in the Community Encounter Digest is just a possible allergy to alert other healthcare providers to it. If a new entry is made in the medical category if a new profile entry is made with the medical category, this information will show up in the healthcare data repository, or in the, excuse me, let me start that again. If a profile entry is made in the medical category, the diagnosis will show in the Community Encounter Digest as a problem reported in this encounter. And it just pulls from this field here to report what the diagnosis was. If a surgical history profile entry is made, that information gets shared to the healthcare data repository, but doesn't get shared to the Community Encounter Digest. And it'll share what was the procedure that was recorded and what was the procedure date that was recorded as well. If a lab task is created during the encounter, it'll be recorded again in the healthcare data repository that labs were ordered. It's not smart enough to recognize individual labs, but it will pull what's in the description field here and also the date that the lab requisition was created. Same with an investigation task. So it'll pull what's in the description field and the date and share that information to the healthcare data repository. And if a referral is made, it will pull from the consult task created the type of consult, the date that it happened, and then if subsequently the clinic can report an appointment date here on the observation side, that also will eventually populate the Community Encounter Digest, and I'll show you where that goes in just a minute as well. Immunizations that are done in the EMR are shared to the Community Encounter Digest as well. A description of the immunization, the date that it happened from the observation, and the lot number are all shared to the Community Encounter Digest. And that basically runs down all of the information that comes out of the EMR and is sent to either Netcare or the healthcare data repository. This slide's really helpful in that it shows how that information feeds back into the Community Encounter Digest. And it's a little bit busy, I know, but hopefully not too difficult to see. Information from demographics informs, of course, who this information is for and makes sure that information flows to the right patient in Netcare. Information from the visit populates the Community Encounter section, including the reason for visit and the diagnosis. Information from the visit also populates the measured observation section. Again, those few vitals that are recorded in the visit are populate to the measured observation section. Allergies, and particularly the allergen in an allergy entry, informs the possible allergy section. Information about a referral done informs the referral section, and again, it's the type and the date, and then the appointment date in the right-hand side. If that's filled in by the clinic, will eventually populate the referral occurrence date up here. Immunizations will flow to the immunization section. Again, apologies that there's not a picture there, but the description of the shot, when it happened, and the lot number will appear here in the CED. And finally, new items created in the profile. We have a surgical history here, but actually should be a medical entry. Any medical entries will show up here in the health concern section. and along with provider name and date. That's quite a lot of information in a pretty short amount of time. We still have a fair amount to do, but I want to pause here and just see if anybody has any questions or concerns, if there's anything that you didn't understand, anything about the mapping that you'd like a little bit more clarity on. I'm happy to answer and happy to take them either in chat, or if you want to come off mute and ask, please feel free.
Hi, this is Lori. I just had a question about past profile entries or past allergy entries. I just want to confirm the only ones that are going up are from the date you go live forward, right? Like nothing of the past profile that was entered before you go live is available on.
Yep, that's correct, Lori. That's a great question, and one that we hear a lot. And yeah, so not only that information, but any information shared through CI, CPAR, whether it's panel information, encounter information, or consult reports, nothing created prior to go live is shared to Netcare. And that just makes sense, right? We don't want people to have to worry about things that they created before they went live. And it wouldn't be fair to be digging back in the chart and pulling things that that were created before people had it in mind that they were participating in this. So it's only information that's entered from go live forward.
So if a physician thinks that's pertinent to be on there, then they should just update their profile, patient's profile, once they go live.
Yeah, they could do, and that's a great question as well, because it leads us into another thing that comes up quite a lot, which is how do I get all of my profile information into the Community Encounter Digest? And so it's important to remember that the Community Encounter Digest is not a permanent record. It's a 12-month rolling snapshot, and this is kind of key because things that show up there will only stay there for 12 months. So the intention of the Community Encounter Digest is to be a snapshot of care received in the last 12 months, not necessarily a complete record of the patient's chart. Now that said, if a physician was concerned that they really wanted something to show up there, they could definitely re-enter it and have it show up there, but it's only going to be there for 12 months. And the thinking behind this is actually related to a piece of feature enhancement, which I'll talk about in a little bit, but I might as well talk about now since you brought it up. There's another piece of CI CPAR that's coming hopefully this year, though we don't know for sure, called the patient summary. And that'll be something that gives physicians who are participating the ability to curate an entry about their patient that can then go to Netcare as a PDF. So a physician wouldn't do it for every patient, but for those patients that keep them up at night with weird conditions or complex conditions, they could create a patient summary to go along with the Community Encounter Digest that would show those things that they are concerned about for that patient. Does that make sense?
Yeah, that's good. Is that PDF going to be a 12-month rollover too, or will that?
No, that PDF will be a permanent entry in the record. The intention being that the primary provider would keep it current with pertinent information about that patient. Like I said, probably most likely complex or unusual patients.
Right. And I'm just thinking about this 12-month rollover, even with like drug allergies, which would be really helpful if a patient was emerge for them to know. So knowing that all of this information does roll over every 12 months, do you know of some clinics that have been doing this for a little bit longer, that part of their processes in their clinic are to like review patients' charts in some way to make sure that this is updated and just keeps current?
I don't know of any, Lori.
Okay.
Like I said, it's not really intended for this to serve that purpose. I know that we've had the question a lot. So, you know, when people realize that the possibility is there, it won't surprise me if some do that, but it does seem kind of onerous. And I think the patient summary is something that makes more sense. It's just not quite available for us yet.
Okay, thanks.
Oh, you're very welcome. All right, we'll move along. So another slide here for you to use to encourage people to go to the website, in this case, encouraging people to go to the website and use the MedAccess EMR guide for CI Par. TELUS Health has worked pretty hard on these, and we've sort of helped them put them together. And there's a lot of information in the EMR guide on how to use the EMR with CI Par. This is the only slide in this package about confidentiality. We really want to encourage people to use the help files in their EMR. Or maybe I'll stop because I see a question in the chat and relating to what we were just discussing, and then I'll move back on to the confidentiality. So the question is, when you roll over, does that mean if there was no data input in the last 12 months that that area would be blank in the CED after 12 months? That's correct. If no data comes in, if it's, say, a young patient who doesn't come in very often and they haven't had an appointment in the last year, then yeah, that area would be blank, meaning that they haven't received any health care in the system at a place that is registered for CI Par in the last 12 months. Back to confidentiality. We really want to encourage people to use the help files on confidentiality in the TELUS EMR help files for MedAccess. They're really quite good, and it's pretty straightforward. MedAccess allows you to make a chart confidential, a visit confidential, or a task confidential, as requirements would allow. And anything that is marked as confidential in the EMR will not share information to Netcare. An additional note here, though, that the easiest way to keep things from going to Netcare is to chart them in fields or areas of the EMR where they're not shared to Netcare. So that's why the mapping is so important. It's super important to know which fields share, but also important to know which fields do not share, so that if you want to chart something that you'd prefer not be in Netcare, you can just chart it in a spot where it's not going to be shared. Second kind of information that is shared through CI Par are consult reports, and consult reports are nice and easy because really they don't share to the healthcare data repository. They are created as PDFs in the same way that you create a PDF to fax to a referring provider. They're created as a PDF and shared to Netcare as that PDF. To send a consult report from MedAccess to Netcare, once the EMR is set up, it's as easy as checking a box. So you can see, hopefully in this screenshot, there's a new checkbox at the bottom called eligible for consult letter extract. If that's checked, then the consult goes to Netcare. If it's unchecked, then it doesn't. There's one other way that you can set up the EMR, though. You can configure it so that all consult reports will be sent, period, if it's a specialist office where everything they do, they're going to want it to go, then they can set it up that way so they don't even have to check the box. But most people will probably set it up so that they can check the box and send them. Consult reports show up in the consultations menu in Netcare. And again, if you hover over there, hover over the entry, you get some metadata about the consult report, and they're easy to find. And again, even though there hasn't been any advertising of this, people using Netcare, particularly in hospitals, are finding these consult reports from community clinics and using them now. It's pretty exciting. The last kind of information shared are panel lists, and you can see that panel lists are shared from the EMR through the CI Data Hub, not to Netcare, but to the Central Patient Attachment Registry. And two kinds of reports are created from that: the demographic mismatch report and the panel conflict report. And we'll talk a little bit about each of those. And again, here you see the healthcare data repository panels are also shared to the healthcare data repository. I've been through the mapping, but just a reminder that there are certain fields that are critical for CPAR: first name, last name, date of birth, gender, PHN status. The status field is important. MedAccess allows you to set statuses to either be CI Par friendly or not, and I'll show you that in a little while. There must be a primary provider in the primary provider field, and of course they have to be registered for CI Par. There must be a demographics validated date. It can't be blank. And there also must be a last visit date, which we'll pull from the panel list. And finally, a physician has to have their panel number in their provider record. Panels are uploaded automatically from MedAccess on the 10th of the month and sent to CPAR. Two things happen when that happens. One, the panel goes into the queue to be compared with other panels by CPAR, but the panel gets compared to the demographic information in the provincial client registry, and the demographic mismatch report is created right away from that. It's available within 2 days after the 10th, so generally the 12th or 13th of the month. That can be gathered from the online CPAR site. And then on the 22nd of the month, CPAR goes into blackout and starts comparing all of the panels that it's received and producing panel conflict reports. And those are available after the blackout period on the 2nd of the following month. Here's what the conflict report looks like. As you can see that there's lots of information in it. There's patient information, provider information of both providers, and most importantly, those confirmation dates and last visit dates show up here. So it's really key to keep those confirmation dates accurate so that both providers are getting the right information about when was the last time the patient was actually seen. It's a good indicator, or when they were last actually confirmed, excuse me, and when were they last actually seen. It's a good indicator of maybe which provider they might actually be currently imagining themselves attached to. The other report is the demographic mismatch report. One of the key things from the demographic mismatch report is that it will identify any patients that are deceased in the patient client registry that the EMR might not know about yet. And that can help clinics avoid some of those embarrassing phone calls that happen when you don't know that a patient is deceased. This slide looks at future state, and I'm happy to say that it's already a little bit out of date because one of the things that it shows is e-notifications, which I'll talk about in a sec. E-notifications are not future state now for MedAccess. They are current state, and the MedAccess clinics that are signed up are receiving e-notifications. I've mentioned the patient summary report. You can see that in the future, the idea is the summary will flow through the data hub to Netcare and also be included in the patient's My Health record. So hopefully we're going to see those within the next year. But in the current environment, we wait to see if the funding is there. I mentioned that e-notifications are live. Just a quick rundown of e-notifications. These come in to inform a provider of an encounter that a patient may have had at an Alberta Health Services facility, either an emergency room discharge, an inpatient admission or discharge, or a day surgery discharge. They come into the EMR twice a day, just like labs. They are assigned as investigation tasks and assigned to the provider who is linked to the patient in CPAR. They don't have a ton of information in them. There's the patient demographics, location, date, time, provider, and admission reason. And if a patient is paneled to more than one primary provider in CPAR, they're all notified, and that information shows up in the bottom of the e-notification on the right-hand side. One other thing to point out is that the dates here are not necessarily in alignment. The date that the encounter happened shows up here in the encounter notification information. The last slide in this section is the benefits of CI Par, and I'm happy to say that we don't always have to show this anymore. A lot of providers are already sold on the benefits of CI Par and are more interested in the nuts and bolts that I just showed. But for those providers who are still not sure or are just learning about CI Par, this is a great slide to show benefits for across the system. So for patients, providers, also for PCNs and for the healthcare system. And I'm happy to be able to say that all of those things that you see under patient and provider, we're already seeing for physicians who are participating. Patients are receiving those benefits We've seen examples of every one of them, and same with the providers. Providers are receiving those benefits, and we've seen examples of every one of those as well. The benefits for PCNs and healthcare systems are more long-term benefits, and I'm quite comfortable we will see them. But exciting now that patients and providers are seeing the positive use of this. The next section focuses on readiness to participate. And probably this is pretty straightforward. There are four general prerequisites for participating. The clinics must be live on Netcare. Their PIA must be up to date, i.e. that means it reflects their current environment. Clinics have to be panel ready, obviously if they're going to be submitting panels to CPAR, and they need to be on one of the conformed EMRs, either HealthQuest, Accuro, MedAccess, PS Suite, or Wolf. A little bit more information about being live on the Alberta Netcare portal. I believe a clinic needs to get live, they should contact the eHealth support team at Alberta Health. The clinic PIA must be up to date, and we've been able to create a number of supports for this information about how to go about getting your PIA updated. And one of the most important things to know is that if the clinic needs a major or minor PIA update, eHealth can help them figure that out. So on our website is the Privacy Impact Assessment Update Self-Assessment. It's a number of questions that the clinic can go through and figure out if they need it to update, and if so, is that a major or minor update? And if a clinic is interested in participating and they do this, then they can work with Alberta Health to get some advice about next steps. This slide, if you're speaking with a group that may be interested in privacy, this slide indicates how to find privacy tools that are available on our website to help. There's an FAQ document, a summary of key privacy info, and of course there's the summary of the privacy impact assessment for community information integration and CPAR that docs should read over before they endorse the privacy impact assessment. And there's also tools there for talking about privacy with patients. Good news is that patients generally get this, and they are actually surprised to find out that less information sharing is happening than they thought. But if patients are privacy concerned, we've got some scripts for the custodian and team. There's a brochure for patient and an FAQ for patients as well that are available. One thing that participants in Netcare and also continuing with CI Par when people join is that they need to inform patients that they are participating. Most clinics do this by putting up a poster in the clinic saying that they're participating and that they're sharing healthcare information for the purposes of improved healthcare. That wording on those posters needs to change a little bit when clinics join CI Par. So if they have those posters, there's a sample of a CI Par updated poster available on our website, and clinics can use those. And finally, there's the panel readiness checklist is a really handy thing on our website. If you're not sure or a clinic's not sure whether they're ready to go, we have the panel readiness checklist. You can go through and see if all of the panel processes that should be in place are there for the clinic. And if every box is checked off, then you're probably in pretty good shape to go. There's a short section here on what physicians must do. So some things physicians must take part in, and other things it's optional for them. So what must they do before going live? They need to know about the mapping that we just talked about. It's important for physicians and all users to understand what's sent to Netcare and what isn't. They, of course, have to make the decision because it's the physician who participates. Physicians have to make the decision to participate. And then when they do, there's forms for them to sign, and they can't avoid that. There's some things that they may want to participate in, but are optional. The clinic identifies somebody to be site liaison who will lead the clinic through the process of onboarding, and physicians may or may not be one involved in that. They may want to be involved in the PIA process. If any PIA work needs to be done, physicians may want to be involved, but they don't necessarily have to be. And finally, they may want to meet with you guys, the PCN facilitator, to talk about CI Par and how it's going to affect things going forward. Once the clinic's gone live, obviously the physician needs to go live. They need to review their panel conflict reports. It's important that physicians see those panel conflict reports and are able to review them so they know if there are patients there that they're concerned about. And of course, they're going to receive those e-notifications when their patients are in hospital, and so they'll need to be involved in the process of dealing with those. They may or may not want to delegate having a look at the CEDs and NetCare for quality assurance. It's important that somebody should look at them and just make sure the information looks good. And there's an optional evaluation that they may want to participate in. And they also may want to participate in quality improvement meetings. That's again up to them. There's a section here on what to expect once you've made the decision to participate. So we've got a couple of slides here that show the steps of the forms that the clinics go through as they are going through the process of onboarding. There's a more complex process for those who have panels and a simpler process for those who don't have panels. Then these slides can help you describe those processes to the appropriate clinics. There's a couple of slides here that show how to fill out the first form, which is the confirmation of participation form. Looks really busy, but they're actually pretty easy forms to fill out, and there's instructions there for everybody. So we've got on the front page, there's clinic information and identifying the participating providers. And on the second page, there's just some information there saying, yep, we're ready to go. We're aware of what this is all about. We've had our training, we've done them, we've seen the mapping, etc. That information is there. The site liaison here says, yep, we've done these things and we're ready to move ahead. And so finally, a few tips for what you have to do before you go live with MedAccess. So there's a bit of a checklist here. If you're going to be submitting panels and encounters, which is most primary providers, the first thing you need to do is accept the terms and conditions for TELUS EMR Mobile. Now, many people will have done this already if they're using EMR Mobile. If you're not using EMR Mobile, that's fine. Accepting the terms and conditions doesn't mean that you then have to use it. It's just that the technology that's used to feed information to TELUS EMR Mobile is also used to feed the information to NetCare. And so that those terms and conditions have to be accepted, and it's an easy step to do. It's basically a checkbox in the settings of the EMR. There's some configuration that needs to happen. The information's the process is described pretty well in the MedAccess EMR guide. Review the EMR mapping, which we just talked about, and understanding how to prevent encounter data from sending, so privacy and security stuff. For those that are sharing panels, there's a new configuration in the status management box, which I'll show you in a second, that allows you to configure statuses for CI Par. And you want to run a panelist for each provider before go live to check and make sure that the list looks the way that you expect it to. And finally, each physician gets a CPAR panel number. Those numbers must be entered in the provider card for each physician. And again, that's a fairly simple process. I mentioned the panel status management box. You can see that there's a new column here called paneled with checkboxes. You would do this once to go in there and check each of the statuses that is appropriate for CPAR, so that patients with that status checked are included in CPAR panels. I mentioned running a practice list before the first upload. The idea here is to run the list and make sure that that the patients on the list look right, that they have last visit dates and last confirmation dates, etc. For those docs who are submitting consult reports, again, accept the terms and conditions for EMR Mobile. There's a site setting that enables EMR integration with community information integration. And then for each specialist who wants to submit consult reports, there's a setting that must be clicked on for each of them one time. It's important for site liaisons pre-go live to familiarize themselves with the team toolkit. I'm sure you guys have seen and heard of the team toolkit. It is your one source for all things CI Par. It's a big document, but there's a ton of information in it. Important that site liaisons are familiar with it as well, so that they know where to find information when they have questions. And finally, the clinic journey checklist essentially takes all of the steps to move from the beginning of CI Par to fully enabled, and puts it into a checklist form so that you can literally go through and check off the boxes as each of the steps is completed. Very handy, and definitely worth working through together with site liaisons to keep track of where you are and know what's coming next. Finally, one more slide, encouraging people to go to our website to get information. Please feel free to sprinkle these liberally through any of your presentations to encourage people to help themselves on the website. And that's a lot of information packed into an hour. I hope that you found it useful, and I'm happy to take questions. We've still got about 3 minutes left, but I'm happy to stick around afterwards if there are questions. So please feel free to come off mute and ask your questions or send them in the chat. And I see a couple of things coming into the chat already. Can the data mapping for the CED be changed after going live on CI Par? The short answer is not really. That mapping has been determined by, one, the data elements were determined by a clinical work group that agreed that the high data elements were the right ones. And then the mapping to the fields in the EMR was the result of a lot of careful work between the CI Par team and TELUS Health. That said, it's possible that if in the future that if there's a field where they're not quite getting the data that they thought they were going to, they could bring it back for discussion to see if maybe it needs to be a different field instead. That's in the future, definitely. We're just getting started, and I can't imagine that would happen at least in a couple of years. And if it did, of course, everyone participating would have to be notified that change was being made. I hope that helps to answer that question. And another question, will Netcare show pending referrals in process from the family physician's office, or if a referral is made if a patient visits ER? Often patients follow up in clinic after an ER visit where a referral to a specialist was suggested, but we're not sure if the referral was made. That's a great question. The system is designed to capture referrals made in the EMR. So if the referral was made from the ER, it's not going to show in the Community Encounter Digest, though I suspect it will show in Netcare in another section. And maybe Sheena can help me with that, because I know that Sheena knows more about Netcare than I do. But if the patient, though, were to come into the clinic after the ER visit and let the doc know that the referral was in process, and that information was entered into the EMR just so that the clinic knew it as well, then that information would be captured and sent to the Community Encounter Digest as long as it was entered correctly. Does that help answer your question? And Sheena asked, maybe if you're still on the call, can you confirm that if a consult referral is done in ER, if that shows up someplace else in Netcare?
Yeah, no, it's a good question, Chris. So right now in Netcare, the referrals won't be reflected from ER. You'll only see referrals in Netcare if it's using the e-referral functionality within Netcare itself. So the ERs currently are not hooked up with that.
Thanks, Sheena. I appreciate that, because yeah, I didn't know the answer to that either.
No problem.
Happy to answer any other questions. And I noticed that Barb has noted here too that med-access fields that map to the Community Encounter Digest are not customizable by clinic. Yeah, absolutely. That mapping is determined, has been determined by the CI Par team and TELUS Health. Another question, does the blood pressure field only show one blood pressure? Just wondering if it will show multiple readings in one visit if more than one was taken. or if home BPs are recorded. So yeah, all of the blood pressures recorded in a visit will show. So if the first blood pressure is unsatisfactory and the clinic does 2 or 3 more, those blood pressures will show as well. Unfortunately, the system's not set up to record whether it was sitting, standing, lying down, but all blood pressure numbers recorded in a visit will show up. Any other questions or concerns?